Family is important to Jeremiah Watts Sr. and his wife Velvet. Their blended family included 4 children until October 4th, 2004, when Jeremiah Jr. was born. But their joy turned to concern after Jeremiah's newborn screening test came back abnormal.
They did some further testing. It was found out that he had sickle cell disease.
Hemoglobin is a protein in red blood cells. It's vital for life because it carries oxygen from the lungs to the rest of the body. But in a person with sickle cell disease, the red blood cells are shaped like a sickle.
When the shape is different, the red blood cells stick to each other and there is not enough blood flow, causing low oxygen states in sickle cell patients.
And that low oxygen, coupled with pooling blood cells, can trigger severe pain. Watts says Jeremiah was diagnosed with sickle cell disease at 6 months old, but his symptoms started about a year later.
Him having pain crises and certain parts of the body swelling.
Watts says seeing his son screaming in pain at home and during hospital visits was more than he could bear.
There was many times that I would go and cry in the bathrooms of the hospitals and things of that nature because I didn't want my parents, my family to know, my wife to see me, my son to see me, because we was already going through so much.
They were going through frequent hospital visits for pain crisis. And board-certified hematologist Dr. Amara Nandakola says stopping the pain requires a blood transfusion.
If the S hemoglobin is at a higher level in the body, there is low oxygen. That is why patients need to get transfusion to increase their adult hemoglobin, which has a higher oxygen carrying capacity than the sickle hemoglobin.
Unfortunately, in January, the American Red Cross declared the first ever blood crisis amid the Omicron surge. That's also why News Channel 8 is partnering with the organization on blood drives to increase the supply and help decrease the amount of pain sickle cell patients experience. According to the Centers for Disease Control and Prevention, the disease occurs among about 1 out of every 16,300 Hispanic American births. But for Blacks or African Americans, it occurs among about 1 in every 365 births. And the sickle cell trait is even more common. It occurs in about 1 in 13 Black or African American babies born. But why? Well, Dr. Nandakola says the answer could be found in sub-Saharan Africa.
The underlying real reason is not known why the sub-Saharan African regions are more prone to sickle cell disease, but it is believed that they are related to malaria, and those patients with sickle cell disease or trait has less severe forms of malaria.
Whether the patient is an adult or a child, doctors say sickle cell disease is so brutal on the body, it can lead to heart attacks, strokes, blood clots, and infections. It's a future Jeremiah Watts wants to desperately change for his 17-year-old son. Watts works with supporters of families with sickle cell disease. The nonprofit organization services the entire state of Oklahoma, helping improve the lives of sickle cell patients. But he also wants to improve public knowledge about the disease.
This is not just a Black disease. This is a disease that affects all race of people, all communities, all circumstances, every day.
Michelle Dixon, News Channel 8.